Okay, Erin, we got one good test. We just need 2 more before we can end, okay?
Okay.
You ready to try again?
Yes.
You feeling okay? Do you need a break or anything?
Nope, I feel fine.
Okay, great. I'm going to go ahead and put your nose clamp on.
Yes, I do.
And take this and hold it to the side.
Just
Sure.
Okay.
Hold it to the side nice and steady. Now wait for the computer. Okay, it's ready. Big breath in as much as you can. Good tight seal. Now blast. Push, 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 push. Blow, blow, blow. Keep going, keep going, keep pushing, keep trying. Empty all that air out. Keep going. Almost done. Just about there. You can stop. Okay, good job. That was a really good test. So what we're going to do is we're going to save that test as well. All right, Erin, are you feeling okay yet? Do you need a break?
No, I'm feeling
It's good to check with the patient in between each test to make sure if they're lightheaded. Now, not every patient is going to have healthy lungs like Erin, so you have to kind of decide, did my patient really do as good as they can? Is someone with COPD or with severe asthma, they're not going to be able, you're never going to get a good test per the computer at all. So you have to decide as the medical assistant, decide, did this patient, for what conditions they have, did they do the best that they can? And so far, Erin's doing really good. So, all right, Erin, if you're ready, we'll go ahead and try and get that last test done. Ready? Lungs ready? All right, nose piece on. Hold this to the side. I'll let you know when the computer is ready. Let's make this our best one, okay? We're going to blast out as hard as we can and blow as long as we can. Let's get a nice, big, hard blast out this time. All right?
I will try.
All right, let's do it. All right, so what I want you to do is big breath in as much as you can. All right, mouth in. Blow, 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 push, 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 go, 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 keep going, keep going, keep going. Great, you're almost done. You're just about there. Wonderful. You're doing great. Just another second or 2, and we're done. Okay, great. Good job. All right, Erin, you can go ahead and have a seat. All right, so now I've gotten 3 good tests on my patient. I've discarded the non-good tests. I've gotten 3 good tests. I'm going to have my patient have a seat and relax for a second because with all that blowing, a lot of times they can feel a little lightheaded. So now on my screen, I've saved the 3. What I'm going to do is I'm going to hit the button that says done, and that's going to take me back to that main menu where 1 is new, 2 is test, and 6 on here then is going to be print. So I'm going to hit number 6 because I want to print out the results. It's going to ask me if I want the best or the last 3. I want the best, which is number 1 as well. And as long as this is hooked onto the dock, it'll automatically start printing. So at this point, what I'm going to do is I do not want to dismiss my patient yet, because if something happens with the printer, it runs out of ink, it runs out of paper, I don't have a patient to retest. So give your patient a few seconds, a minute here while this prints out to relax, and you can check and see how, are you feeling okay? You're not lightheaded or anything? Everything's good?
Yep, everything's fine.
Okay, wonderful. So we're just going to have you sit here for just a second while we get these results out. Now I have 1 page of my results. I just need to grab the other page and it will print in 2 pages for this machine. Once I have these 2 pages, then I can go ahead and let my patient go. Well, while that is printing, what I'm going to do is I'm going to come over here and I'm going to fill out this encounter form, and this is your documentation then, okay? So the encounter form is going to be your date of service, your patient's name, and your patient's date of birth, just like we fill out all encounter forms this way. For us here at SWIC Family Medicine, we're going to use the 99212 code. My patient, we're going to say, has asthma. We always need a diagnosis code to go with the procedure. The procedure I did was spirometry, okay? So the things that need to be filled out are 3 things across the top and 3 things circled on the bottom half of the encounter form. So this encounter form is filled out and complete. Then also documentation on the progress note is going to include, every progress note should have your patient's name and date of birth on, no matter what. Name and date of birth are absolutely essential. So I have my patient's name, her date of birth. I have today's date and time, spirometry performed, results in chart, and signed by me. Okay, now I have my spirometry results. What I'm going to do is one more time. All right, Erin, we're all finished. You can go ahead and stand up. I just need you to take this form out to the front desk for you to check out. Did you have any questions?
No.
Okay, have a good day. Thanks. Goodbye. Now I've sent my patient off. She's got her encounter form. She's going to check out at the front desk. What I'm going to do with this is now I'm going to put it on the front of the chart. Since I have my documentation done, I have my test done, and I'll put this on the physician's desk. Okay? Now, the last thing that I need to do is kind of finish up and clean up in my room. That may include putting the chair away. I'll need to make sure that I take this pneumotac and put it in the biohazard bag. My biohazard bag is across the room, so I'll go do that. It's essential. That's one of the steps on the checkoff, that you put this in the biohazard bag, so you need to make sure you do that. The other thing is you need to make sure that you turn the machine off when you're finished. My area is clean. If my patient was on the table, I'd need to clean the table, but my patient was not on the table. She was just in a chair for this particular procedure. So now the last thing that I need to do is to go wash my hands. And I will go to the other room and do a medical aseptic hand wash, and we are done.